Well, Darren Hughes is from the NHS Confederation, which represents Welsh health boards. Good morning.
Good morning, Board.
I mean, when you hear somebody like Maya there clearly struggling, it's incredibly worrying. What are you saying to people like Maya at the moment?
I think things are very difficult, and apologies that Maya hasn't found it as easy as she normally does to access the mental health support that she needs. But it is really important to say that mental health services are still being provided across Wales for those who need them. But unfortunately, due to the social distancing restrictions and the COVID, people are accessing them differently, and people are finding it difficult to sort of make contact in the first place. So what I'd really like to say is that support is there for those that need it. There's some excellent help available, signposted help. Public Health Wales are running a campaign called How Are You Doing? As you mentioned already, Hafal and Mind and other mental health charities are signposting people, but we are needing to deliver services and support differently because of the effects of COVID.
Yeah, and that support is clearly vital to people like Maya. Going from like a meeting twice a week face to face with somebody, and then having to deal with a video call. Clearly something she's not that comfortable with. But mental health charities, on these video calls, the counselling sessions, they say it's like a postcode lottery, available in some areas, but not in all. For example, like Maya, who falls under the Hawddda Health Board. Why is that?
I think in the early days of the COVID crisis, I think it was difficult because what we were asking staff to do across the NHS is work from home, do things through a video conference. And it isn't just as simple as for those of us who would text message or Skype family and friends. Obviously, people working from home need to have a suitable environment. People have had children around them, and also the security of the network in terms of patient data being available and information. It was quite difficult. We are, confident that things are running much more smoothly now, and staff are doing what they can to deliver through these new channels.
Yeah, what would you say to people listening though who are in these not spots, who aren't available, who can't get these video call sessions?
I don't think there are not spots now. I think the health boards across the country have put in place measures, and the voluntary sector, Mind Cymru, Samaritans, the call helpline, that the help is now there. And it's really important that people are, there's a lot more stress for people, their usual support mechanisms, local support groups, talking to family and friends, even going outside more often and taking exercise is really helping people with their mental health. And the whole shadow of COVID is making things much more difficult for people who usually access mental health support, but also making it more complicated to provide the support that they need. But just rest assured that the support is there if you need it. And what I'd like to say again, to bang home the point, is please look online and please contact your local GP and the usual ways that you might access mental health support if you need it.
And people listening this morning, we've talked about personal protective equipment a lot on the show. I mean, why can't mental health teams offer, the face-to-face counselling that is clearly needed with the use of PPE? Can't it be done under those circumstances?
In some places, well, across Wales, this face-to-face support is happening. It is much more difficult, but if people are in crisis, that support is there. The fact that people are communicating wearing face masks and face shields is obviously stressful for those people seeking support, but it actually makes it more difficult to deliver it. It is happening across Wales, but it's obviously much more difficult than in normal circumstances. And we'd say to people who do want support, contact your local support networks as usual, and everything that can be done will be done to support you.
We've heard about another woman in North Wales who's been dropped from her mental health support team and told to get a new referral from her GP after the pandemic. I mean, she has said it's taken 9 months to get referred at the last time. I mean, how troubled are you by hearing that? I mean, is that something which unfortunately more people might now experience?
It was difficult. People receiving inpatient support at the start of COVID, obviously, when the modelling was done about what could be done to negate the risks caused by COVID-19. Some people were risk assessed and each case looked at as an individual, dependent on the person's needs. Some people were discharged. But if people are not coping, again, I can't say strongly enough, please do get in touch with your GP again. GPs are operating, you can get appointments. Do all you can and contact the help and support in your local community as you would do normally.
Because some people might just say, why can't the people's treatment just be put on hold at this time instead of having to go through the referral process again?
I think people's treatment definitely shouldn't be put on hold. I think we're seeing across the NHS where people with non-COVID urgent conditions are putting off contacting the NHS, their GP, their local hospital, and things are getting worse. What's a small problem today can be a big problem next week, next month, if people don't seek the help they need. Please, just a sort of key message from me really is that support is out there. It might be a little bit more difficult to access it in the usual ways and be delivered through a different route, but if you're in need of help and support, please do seek it, and it will be there for you.
Darren, thank you very much. Darren Hughes there from the NHS Confederation, which represents Welsh health boards.